Is this on? Is that okay? Not that it's a big room, but wanted to make sure that all the things were set up correctly. I'm Robert Sprague, State Representative for the 83rd House District and Chairman of the Prescription Drug Addiction and Healthcare Reform Study Committee. And I'm pleased to be joined here by two of our committee members, the Vice Chair, Representative Ryan Smith, and a committee member from Cuyahoga County, Nan Baker. I'm very pleased that they're both here. Thank you for coming today. I'm pleased to be here to announce the summary of the Chairman's report on the committee findings from our work this summer. In an effort to take this important conversation into the local communities and hear from the public, members of the study committee traveled throughout Ohio and held 4 regional hearings. We hope that by taking the committee's work on the road and giving Ohioans a forum for sharing their experiences with us, we would gain a wide breadth of helpful information. In total, we had over 16 hours of public discussion and heard testimony from 81 witnesses, which ultimately will assist our efforts to more effectively address prescription drug addiction. We learned that 80% of heroin addicts started their addiction with prescription opioids. People don't want to begin injecting themselves with a needle to get high, but rather start by taking a pill. Since commonly used painkillers such as Oxycontin, Vicodin, and Percocet are similar in chemical composition to heroin and other opioids, there's a high potential for addiction and abuse from the painkiller drugs in our medicine cabinets. We learned that these pills, which lead to addiction, come solely through the prescription pad of licensed doctors in Ohio. There were enough doses of opioids legally dispensed last year for every man, woman, and child in Ohio to have almost 70 doses apiece. We heard that in an effort to aggressively treat pain in our society, that now the pendulum has swung too far, that pain is now being overtreated, and the result is a public health epidemic of prescription drug and heroin addiction. We learned that opioid addictions occur in a matter of weeks because of the mu receptor in the brain releasing massive amounts of dopamine in areas of the brain that govern our natural survival instincts. This rewires the circuits in the brain to make feeding the opioid addiction that person's #1 priority. We learned that opioid addiction is extremely hard to overcome and that it's a physical as well as a mental addiction. After the drug regularly starts attaching to receptors in the brain, the opioids fool the addict into thinking they are a necessity just as much as food and water. Drug overdose has become the leading cause of accidental death in Ohio, surpassing traffic accidents. Prescription opioids are responsible for more deaths than heroin and cocaine combined. Behind every overdose death, there are thousands and thousands more who are addicted to opioids and that leave in their wake devastated parents, abandoned children, and drug-infested communities. According to one judge that testified, he thinks that 80% of crime in his docket has its roots in drug use. As a General Assembly, we can take steps to fight this epidemic. First, we must strive to limit the amount of opioids being prescribed through our medical system, thereby slowing the rate of new people becoming addicted. Second, we need to prevent people who are already addicted from diverting more pills from the medical system. Third, we need to keep people alive even when they are consumed by the misery of their addiction in the hopes that they will eventually get treatment and recover. And fourth, we need to integrate the addiction treatment that is now being practiced in medical silos and fund the court system specialty dockets that are clearly providing success in getting people off opioids.